Have you ever tried to follow a conversation in a foreign language? It can be pretty confusing, right? Well, studying the human body has its own special language called anatomical terminology. Just like any new language, it might seem a bit intimidating at first, but trust me, it's not as complicated as you might think. Imagine a group of doctors trying to discuss a patient's injury. One doctor says, "The pain is in the back of the leg," while another says, "No, it's more like the side of the leg." This is where anatomical terminology comes in to save the day. By using precise terms, healthcare professionals can avoid confusion and ensure everyone is on the same page. Anatomical terminology provides a standardized way to describe the location, position, and relationships of different body parts. This common language ensures clear communication among scientists, doctors, and students around the world. So, buckle up and get ready to explore the fascinating world of anatomical terminology. We'll break it down into bite-sized pieces and make it fun and easy to understand. Before we dive into the nitty-gritty of directional terms and body planes, we need to establish a common reference point, the anatomical position. Think of it as our home base, a starting line for our anatomical journey. In the anatomical position, the body is standing upright with feet flat on the ground and shoulder width apart. Arms are at the sides, with palms facing forward and thumbs pointing outward. The head is held straight, and the eyes are looking forward. Why is this position so important? Well, it provides a standardized frame of reference from which we can describe the location of any body part, regardless of the body's actual position. For example, we can say the heart is superior to the diaphragm, meaning it's located above the diaphragm, even if the person is lying down or doing a handstand. The anatomical position ensures consistency and accuracy in anatomical descriptions. Now that we've established our starting point, let's learn some directional terms that help us navigate the human body. These terms are like compass directions for anatomists, guiding them through the intricate landscape of the body. Superior, or cranial, means towards the head or upper part of the body. For example, the head is superior to the neck. Inferior, or caudal, means towards the feet or lower part of the body. The feet are inferior to the knees. Anterior, or ventral, means towards the front of the body. The chest is anterior to the back. Posterior, or dorsal, means towards the back of the body. The spine is posterior to the heart. Medial means towards the midline of the body. The nose is medial to the ears. Lateral means away from the midline of the body. The ears are lateral to the nose. Proximal means closer to the point of attachment to the trunk. The elbow is proximal to the wrist. Distal means farther from the point of attachment to the trunk. The fingers are distal to the wrist. These directional terms are always used in relation to the anatomical position, providing a clear and concise way to describe the relative positions of body parts. Section 4. Slicing and dicing, understanding body planes. Imagine slicing through a loaf of bread to get a better look at its layers. Similarly, anatomists use imaginary planes to divide the body into sections, making it easier to visualize and study its internal structures. The sagittal plane divides the body into right and left halves. A mid-sagittal plane cuts the body into equal right and left halves, while a parasagittal plane creates unequal halves. The frontal or coronal plane divides the body into anterior or front and posterior or back portions. The transverse or horizontal plane divides the body into superior or upper and inferior or lower portions, creating a cross-section. Body planes are essential for medical imaging techniques like MRI and CT scans. By taking images along different planes, doctors can get a comprehensive view of internal organs and diagnose injuries or diseases. Section 5. Hidden compartments. Exploring body cavities. The human body is like a well-organized house with different compartments to keep things tidy and protected. These compartments, called body cavities, house and protect our vital organs. The dorsal body cavity is located on the posterior, or back side of the body. It's further divided into the cranial cavity, which houses the brain, and the vertebral cavity, which encloses the spinal cord. The ventral body cavity is the more spacious cavity on the anterior or front side of the body. It's subdivided by the diaphragm into the thoracic cavity, or chest cavity, and the abdominopelvic cavity. The thoracic cavity contains the heart, lungs, and major blood vessels. The diaphragm for the boundary between the thoracic and the abdominal cavities. The abdominopelvic cavity is further divided into the abdominal cavity containing the stomach, intestines, liver, and more, and the pelvic cavity, which houses the bladder, reproductive organs, and rectum. Body cavities provide a safe and stable environment for our organs to function properly. They also allow for movement and expansion of organs, such as the lungs during breathing. Section 6. Mapping the abdomen quadrants and regions. The abdomen, often referred to as the belly, is a busy hub of activity, housing a variety of important organs. To describe the location of abdominal pain or masses accurately, healthcare providers divide the abdomen into 4 quadrants and 9 regions. Quadrants. The right upper quadrant, or RUQ, contains the liver, gallbladder, and a portion of the pancreas. The left upper quadrant, or LUQ, houses the spleen, stomach, and part of the pancreas. The right lower quadrant, or RLQ, contains the appendix, cecum, and a portion of the small intestine. The left lower quadrant, or LLQ, includes the sigmoid colon and a portion of the small intestine. Regions. While less commonly used, the 9 regions provide a more detailed map of the abdomen. These include the right hypochondriac region, the epigastric region, the left hypochondriac region, the right lumbar region, the umbilical region, the left lumbar region, the right iliac region, the hypogastric region, and the left iliac region. These divisions are invaluable for diagnosing abdominal problems. For instance, pain in the RLQ might suggest appendicitis, while discomfort in the epigastric region could indicate a stomach issue. Understanding anatomical terminology, from directional terms to body cavities, is like learning a secret code that unlocks the mysteries of the human body. By mastering this language, we can communicate more effectively about our health, diagnose illnesses with precision, and appreciate the incredible complexity of our own anatomy. Thank you for watching this video. Remember to like, share, and subscribe to my YouTube channel for more amazing videos on anatomy and physiology.